हेलो, गुड आफ्टरनून फैमिलीज। होप आप लोग सब अच्छे होंगे। सो माय नेम इज़ सावन कुमार, सेक्रेटरी केस मैनेजर। सो आज हमारी टीम जो प्रेजेंट करने जा रही है टॉपिक बायो साइको सोशल अप्रोच इन मेंटल हेल्थ। सो फर्स्ट ऑफ ऑल टीम से मैं प्रेजेंट करता हूँ। फर्स्ट मिस अरुंधति, अंजलि एंड मिस्टर मेवल। सो आज का जो टॉपिक है बायो साइको सोशल अप्रोच, हमने क्यों डिसाइड किया है मैं आपको बताता हूँ। फर्स्ट मैं आप लोगों से जानना चाहता हूँ कि आपने इस तरह का अप्रोच या ऐसा बायोलॉजिकल साइकोलॉजिकल सोशल किसी साइकेट्रिक या किसी मेंटल हेल्थ में आपने सुना है कभी इस तरह का? एनीवन कभी जानने की कोशिश किया है क्या होता है? सो मैं एक्सप्लेन कर देता हूँ, फिर मेरी टीम आपको ब्रीफ में पूरा एक्सप्लेन करेगी। सो बायो साइको सोशल अप्रोच हमें जानना क्यों ज़रूरी है एज ए फैमिली, हमने डिसाइड क्यों किया, क्योंकि हम एज ए मेंटल हेल्थ बायो साइको सोशल अप्रोच तीनों फैक्टर पे हम काम करते हैं और तीनों फैक्टर को जानने के बाद हम डायग्नोसिस और ट्रीटमेंट का प्लान करते हैं। बायोलॉजिकल मतलब हमारे बॉडी और ब्रेन में क्या इफेक्ट होता है, साइकोलॉजिकल हमारे इमोशनल थॉट्स और बिहेवियर्स में क्या क्या चेंजेस होते हैं, और सोशल फैमिली डायनामिक कल्चर्स बिलीव्स, ये सारे फैक्टर्स हमारे ऑलरेडी एक पेशेंट के आसपास रहते हैं, इनसाइड और आउटसाइड दोनों साइड में। सो फर्स्ट ऑफ ऑल मैं इनवाइट करूंगा मिस अरुंधति को कि वो सेशन कंटिन्यू करें और एक्सप्लेन करें कि उनका एज अ बायोलॉजिकल फैक्टर क्या क्या होता है, हम किस तरह से फाइंडिंग करते हैं एक मेंटली इल पेशेंट के अंदर। सो आई कॉल वुड लाइक टू अरुंधति।
Good afternoon, everybody. So today we'll be discussing about biological aspects which influencing mental health. We are not going to have a thorough biology lecture, but we'll be discussing about which are the key elements which influencing mental health in a biological way. So shall we move on to the session? Okay. So what do you mean by biological aspects or biological factors? Any idea from your side? Okay, biological aspect simply means physical and psychological aspects which influencing biological way in mental health. That in simpler way, genetics, neurotransmitters, substance, and how chronic illness is influencing mental health. Moreover, biological aspects is rooted in brain and physical body. So that is the core aspect about biological way which influencing mental health. Okay, what is the need of understanding about biological aspects in mental health? So why do you want to know about biological aspect? What is the need or what is the importance? So the first thing is understanding about biological way. It's just like a medical condition. Mental illnesses are simply like medical condition. For example, imbalances in insulin level can cause diabetes, right? So just like a medical condition. The second one is understanding about biological aspect can increase awareness in ourselves about mental illnesses that can reduce stigma and false beliefs, and also it can definitely help those who needs help in better treatment. And the third one is it can effectively manage our emotional health and also how our brain and body is interconnected, how these biological factors are influencing our brain and it causes mental illnesses. And one more thing, biology is never only the factor of mental health. There are social and psychological factors all together causing mental illnesses. That's why understanding biological, social and psychological approach is important. Okay, this is a brief basic thing about biological aspect. Now yes please.
So when we say biology, at least I understand it as genetics has an influence.
Yes, please.
And the chemicals in the brain may have a huge impact. Is there anything else other than that that you mean by biology?
Okay. Thanks for the question, sir. Actually, we'll be discussing about the 7 key elements which influencing mental illness in a biological way. As you said, neurotransmitters plays a vital role. We'll be discussing about neurotransmitter, other factors also. We'll be going to that slides. Okay, shall we move on to the next slide which influencing which talks about influencing factors in a biological way. Okay, the first part is genetics. As you all know, mental illnesses runs in families that can be passed down to generations. So hereditary plays a vital role. Disorders like bipolar, schizophrenia, depression can run in families that can increase the risk. And the next one is brain structure change in brain. So there are some important parts in our brain like hypothalamus, amygdala, prefrontal cortex. These parts play a vital role in our mental health, and abnormalities or structural differences in these parts can cause serious impact on our mental health. So we'll be discussing about that also. The other one is neurotransmitters. As Sir mentioned, neurotransmitters are chemical messengers. They have particular role in our mental health. They play particular jobs in our mental health, like serotonin, dopamine, GABA. Those are few neurotransmitters. They can also influence our mental health. Imbalances in these particular chemical factors can influence us, and also they can impact our mental health. The other one is hormonal problems. As we all know, hormones are also chemicals like thyroid hormone, adrenal hormone, sex hormones. These hormones also plays an impact in our mental health. Imbalances in their levels can cause mental illnesses. The other one is self-medication and substance-induced disorders. Self-medication and substances can impact, trigger, or mimic mental illnesses. The other one is chronicity. Chronicity, chronic medical conditions can trigger and impact our mental health and cause mental illnesses. The last one is physical health. Physical health, chronic illnesses can also impact our mental health. So these are the 7 key elements which influencing mental health in a biological way. We'll be briefly discussing about all these elements. Okay, shall we move on to the next slide? There is a slide which shows how heredity influencing mental health. There is a comparison between third, first and second degree relatives and how genetic overlap and risk level implies. When we look at the first one, which is third degree, which is first cousins and great grandparents, there is a genetic overlap of 12.5 and the risk is very slight or mild. There is only slight or mild influence of diseases to pass down to generations or to families. When it comes to second degree relatives like grandparents, uncles or aunties, there is a genetic overlap of 25%. That is a moderate level of risk that is passing down to generations or diseases which can be run in families. When it comes to the first degree relatives, that is parents, siblings or children, there is a 50% of chance to diseases can run in families, also can pass down to generations. That is a high risk level is there. For example, if the parents are having a disease, there is 50% chance to that can be passed down to children. If one sibling is having that particular illness, there is a 50% that the other sibling will also have the particular illness. That can be seen in depression, bipolar disorder and schizophrenia. Okay, so we will be moving to the next slide. Sure, please.
When you say 50%, you are considering all the other factors are not influencing, right?
Okay. The SARS question is, you said there is a 50% of chance in first degree. So when other factors are also influencing that.
You say there is a 50% as a major,
Yeah.
other factors are not considered. It's only the genetic factors can influence 50% of that.
Sir, there is one more thing. Even though a person is having vulnerability or the person is having this particular predisposition means if we are getting some particular genes or a particular illness from our parents, there is one major role plays trauma or trigger or environmental factors. If in our life we are exposing to particular things, particular traumas, particular triggers, that can trigger our illness, that can result in mental illness. So even though the biological factor gives us a predisposition of 50%, there are other factors also influencing. That's what I said earlier. mental illness is never only biology, it is psychological and social. So we have to consider all the factors altogether. So when it comes to the second slide, which shows heredity and mental illness. So the second slide is brain structure and mental health. Here you can see a MRI scan. The first slide, which talk about the brain structure of a schizophrenic person, there is an enlargement in the ventricles. As you all can see, there is an enlargement in the ventricle, whereas in a healthy brain, there is no enlargement in the ventricles. As I mentioned earlier, there are some particular important parts in our brain like hippocampus, amygdala, prefrontal cortex, ventricles. Some structural differences, shape differences, size differences can impact our mental health. So it is proved that schizophrenic brains has enlarged ventricle compared to healthy brains. So that is also impact our mental health. This is a picture which shows differences between a schizophrenic brain and a healthy brain, which has an enlarged ventricle and the other one which doesn't have. Okay, shall we move on to the next slide? As Sir asked the first question, which is a neurotransmitter. Neurotransmitters are simply chemical messengers. We have taken 3 neurotransmitters like serotonin, dopamine and norepinephrine. So these neurotransmitters have some certain jobs or roles in our mental health. Like serotonin, which regulates mood, anxiety, sleep and our appetite. Imbalance in serotonin can impact our mental health, that can cause depression and anxiety disorders. So levels or imbalances in neurotransmitters can impact our mental health. The other one is dopamine. Dopamine controls our reward, motivation and pleasure. Imbalances in dopamine level can cause schizophrenia and bipolar disorder. The other one is norepinephrine, involved in alertness, response and all, which can cause depression, PTSD and anxiety if the levels are not moderate, if the levels are imbalanced. So we have only taken a few neurotransmitters for your reference. There are other neurotransmitters also which plays a pivotal role in our mental health, and imbalances can greatly influence our mental health. So we'll move on to the next slide. As I mentioned earlier, hormones are also chemicals which influences our mental health and our well-being. We have taken 3 hormones like cortisol, thyroid hormones and oxytocin. Cortisol regulates our stress response. Imbalances in cortisol hormone can trigger depression, anxiety and PTSD. When it comes to thyroid hormone, as we all know, thyroid hormone controls our metabolism and our energy levels. Imbalances in thyroid hormones can cause depression and bipolar disorder. And the third one is oxytocin, which affects our social bonding. Imbalances in oxytocin hormone can trigger autism spectrum disorder and anxiety. These are only few hormones. There are other hormones also which plays major role in our mental health and emotional well-being. Imbalances in certain chemicals like hormones can impact our mental health and can cause mental illnesses. Okay, we'll move on to the next slide, which is chronic illnesses. Chronic illnesses like heart disease, blood pressure, diabetes, any kind of these chronic illnesses can impact our mental health and also cause mental illnesses. That can increase our risk for anxiety and depression. And also they can impact our brain structure and our emotional well-being and our cohesion also. So chronic illnesses also plays a vital role in our mental health. That can cause a risk. It increases the risk factor of mental illnesses. The next slide is self-medication and a substance-induced disorder. Self-medication itself is not a good idea. It can cause a lot of problems in our life, mentally and physically also. So self-medication plus substance-induced products can cause. Depression can be caused by alcohol and sedative use. Psychosis can be triggered by hallucinogens and stimulants, and anxiety due to withdrawal and intoxications. As I mentioned, self-medication itself is not good idea. Plus, coming to these substance-induced disorders, these both can worsen the situation, trigger and mimic mental illnesses. Okay. When it comes to chronicity and medical adherence, mental illnesses are chronic As we all know, regular medication can prevent relapses. Then, family history can affect treatment response. For example, two individuals from the same family are influenced by the same illness. The first person is responding very well with a particular medicine. So the second person will also react with the same medicine in a better way. So understanding family history can play a very big part in their treatment. Understanding which particular type of medicine can influence them, can increase their medical adherence, and can increase their management. So understanding family history is also a vital part in the treatment also. So we have come to an end of this, which are the key factors or key elements which influencing mental health. Any questions so far? Or else we'll move on to the next segment. Okay. So here is a small case study or a case story that we have taken. This is a 35-year-old female who is having constant restlessness, rising heartbeat, and trouble sleeping. These are the three symptoms of a 35-year-old woman, and family thought she was like overthinking, stress or something. But when they consulted with a doctor, the medical report showed that she is having thyroid imbalance. That is why she was having anxiety. So, thyroid imbalance caused her anxiety. So, the underlying reason for anxiety was thyroid. That is how our body and our mind is connected. There are a lot of reasons for mental illness when it comes to biological aspects. Biology is greatly influenced by mental health. And okay, so we have come to an end of the biological aspect factors. Any doubts? Yes, sure. So there is also when you get tensed, you can have gastrointestinal problems and anxiety. There is symptoms of anxiety, gastrointestinal symptoms are also there. You will get stomach ache, it's there. So it's a great question from your side, sir. We'll be talking about at the end of the session we can discuss about it. Now we have come to an end of my part, which is the biological aspects. If you have any doubts, any clarification regarding this part, we can discuss. Or else we can move on to the next. Yes. Thanks for the response, sir. Please be seated. So I'll repeat sir's question. Sir was asking, he was having two kids, and first one is, he said there is no abnormalities, and the second one is little bit MR. He was asking, he was slightly disturbed when the time of that period. Was it the reason? Sir, mental illness is greatly influenced by three things: biology, psychology, and social. These three factors can input to a mental illness. So we can't say that this is the only part which played a major role. We can't say that. There will be a lot of factors which played a person's mental illness, and there are that we will discuss. So we have discussed biological factors. We will be discussing psychological and social factors. So you will get an answer at the end. We will discuss about that also, sir. Yes.
Yeah, my question was, I wanted to know if what exactly is precipitation of mental illness in context with the fact that mental illness is covered under, the overall biological case.
Okay. So as you said, there are a lot of predisposing, precipitating factors are there in biology, and the psychological plus social factors are also predisposing and precipitating factors. See, precipitating factors means something which precipitate the already existing part. It's like a catalyst which increases the speed of something. So if you're already having a vulnerability, a social event, something, a breakup, a business loss, something can act as a precipitating factor in your mental health, in your mental illness also. Okay, we can further discuss the topic later in our last session. Okay, Pallavi? So I'll be calling Ms. Anjali Joby to discuss about psychological aspects. Anyway, thank you for your support and coordination. Thank you.
So, good afternoon, all. Moving on to the psychological factors which we are going to discuss, I would like to share that movie clip we have already shared on the first time before the session starts. So, I'll be sharing the movie clip once more. So, this was the movie clip from the movie Inside Out. So we have seen different kinds of emotions. So we are planning to discuss about what are the psychological factors which is affecting to mental illness. So from your perspective, what can be the psychological factors? Anyone? If anyone have any answer, you can raise the hands. What are psychological factors? In a single term. So basically, psychological factors, we can say it as a simple term as emotions. Like it will be the internal influences of a person which is related to a person's mind, thoughts, and behavior. Mainly thoughts, feelings, and behavior. It will be the internal factors which is affecting the person. It can affect a person, like how they perceive a situation, how they manage the situations which is coming to their life, and how they make decisions regarding any serious situations, or how they interact with people around them. So these factors, these psychological factors, can shape a person's mental health, motivation, learning, and personality, and overall the well-being of a person. These psychological factors are responsible for the overall shaping of the well-being of a person. So we will be discussing the key psychological factors. So first one is motivation. So motivation is a emotion which drives a person to act or achieve their goals in their life period. For example, a student is going for studies, so their goal will be passing the exams or getting a better result. So it can be the motivation for the student to achieve their goal. So second one is perception. Perception in single terms we can say that how we perceive the external stimuli or the situation or the informations we get. So perception is how we perceive the situations or the external stimulus. Third one is attitudes, belief and past experiences. Attitudes and belief means a person's mindset. A person's mindset that values and shape their entire behavior. It is the attitudes and belief, and the past experiences will be the past events which can also help to shape their future. It is the attitudes, beliefs, and the past experiences. So the fourth one is personality traits. Personality traits means the character of a person, which will be persistent for a long period of time. They will be having that character for the longer period of time, which influences their entire behavior, the behavior towards external world. It is the personality traits of a person. So the fifth one is emotions and cognition, also the thinking patterns. Emotions are the feelings, like we have already seen in the movie Inside Out. The emotions are the feelings that affects the reactions and the decision making of the person, and the cognition is the thinking patterns, like how a person will process, analyze and solve whatever they are facing. It is the cognition, like thinking patterns. So these are the key factors of psychological factors. So moving on to the next slide, we have already discussed that thoughts, feelings and behavior is the overall factors which comes under the psychological factors. So we will be discussing each factors by examples like thoughts, behaviors, and the thoughts, feelings and the behaviors. So thought are the mainly mental process and ideas which comes through our mind, which continuously run through our mind are the thoughts. We all know about the thoughts. Like we all have the thoughts. Every day we will be thinking about various factors, various things. From morning to until bed, we will be having a pattern of thoughts in our entire day thing. So these thoughts are how we perceive or how we shape the situations, how we make decisions. As we said earlier, how we make decisions, how we act according to the situations, these all comes under the thoughts of a person. So there are two kinds of thoughts, positive thoughts and negative thoughts. The positive thoughts will be like hopeful, good and expecting good things to happen in our entire life period, and the negative thoughts will be which will ruin our day, which will ruin our complete mood of the day. These are the negative thoughts of a person. For example, in positive thoughts we can say that I can handle the situations and I can move on from the situations. And in the negative situations, how can I manage these situations? How will I move on from the situations? And we will be ruining our entire mood due to these negative thoughts. So the second thing is feelings. Feelings are the strong emotions or which comes from our mind, and it can reflect our body reactions also. We have already seen the movie clip that whenever the anger is coming or whenever the emotion sad is there, the person will be crying. Or if a person is happy, they will be expressing their emotions like in a happy mood for the entire period of time. So the basic emotions are happiness, sadness, anger, fear, surprise, and love. So we are all know about the how emotions are. So the third one is behavior. Behavior is how a person acts, how a person speaks, how a person be to their outer world. It's the behavior. So through behavior we can express our thoughts and feelings. So they are interconnected. These are like a cycle. So thoughts, feelings and behavior are interconnected. When a person is having some thoughts, they will have feelings, and because of the feelings, the behavior will arise. So moving on to the activity, we have already given some toffees to you, right? So you will have a thought that why are you giving these toffees? So we can have an interactive session regarding that. So what are the thoughts you had when you got the toffees?
Hello, my name is Meeral Tomi. I'm a counselor working here in TriStar campus. Few of the families may not be familiar with me as I'm not very quite frequent here. Yes, I have completed my social work and I've been working here for 2 years. So I'll be covering the social factors of mental health, especially that domain which is very predominant but often misconceptualized or minimized. We are well versed with biological factors, like we always go to the doctor and we get medicines. We are well versed with the psychological factors. At times recently people have started taking therapy. All of us are therapists, right? At least a family member, there will be a counselor. But what happens socially, environmental, nothing happens here isolated. Like a biological factor or a psychological factor, I'm not undermining those, but still social factors have a predominant role which is often minimized. So let's start with the first slide. You can see what are the importance of social factors. Like mental illness does not happen in isolation, it is deeply affected by the social environment. Like along with the biological aspects like medication or along with the psychological counseling, so psychotherapies, the family members or the caregivers, what are we doing? Like, are we really supporting or encouraging or providing or bestowing enough care for the loved ones when it is needed? That is what we really concerned about social factors. Secondly, social factors can be protective, like it helps recovery, or risk factors make illness worse. At a time, okay, consider about a situation in which both of the clients, like I have a example of two of the clients, both of the clients are diagnosed with depression and both are taking same medication and both are undergoing same therapeutical or same clinical, both are consulting with the same clinical psychologist as well, but they are in different families. For one of the client, the family is very supportive and they are providing all sort of care they can provide with. They encourage, they motivate, they help him to get up early in the morning, like encourage them, appreciate him, respect him. They always keep food reserved for him. They encourage him to take part in activities like household chores or go for any part-time job or enroll into any sort of courses which is as of his limits, understanding and comprehended well of his limitations. And the other family, they may also consult with the doctor. They may also send the resident or the client to the same clinical psychologist. But when it comes to the family, they don't even mind. They allow the client to be inside the room solely. They don't even encourage him to wake up in the right time because he is lazy. He is procrastinating. It's always being lazy or procrastination doesn't mean it is laziness. It is a request for help, especially in depression and negative symptoms of schizophrenia. You can see they are not at all motivated because they don't have that motivation within themselves. So it has to be external. Internal motivation I can understand, but it's all about neurotransmitters, as we say. If they are not bestowed with enough or sufficient dopamine, they may not be able to do that. But when it comes to an external motivation, for sure, it can support them, it can stimulate them and enlighten them to do certain things, and it has to happen from family. We aren't doing any sort of magic here in rehabilitation center. We are just bestowing that support. We are just helping them to wake up in the right time and do certain activities, and we provide them rewards and we respect their needs, requirements. Like, I mean, if they want, okay, I'm doing this certain things, reward me with an outing. We will advocate for them. That is what is been happening as the social factor here. Fine, we will go to the next slide so that we get a clear understanding what are the social determinants of mental health. So I'll be just explaining about all the factors or the determinants just with few examples. Like the first one is family support and relationship. See, I had a client who was diagnosed with schizophrenia who stayed here for a short term period of 3 months and thereafter he got discharged. So at first what happened is he was not ready to work or he was not ready to enroll into any sort of course. He was just ideally being sitting in the home and not doing anything. But our family who was admitted that client to here, they were well educated and they were highly educated psychologically. We could provide them proper psychoeducation, and the family hasn't even considered this client as lazy. They didn't blame him. They didn't blame him for the reason he is being ill or for the reason he is being sick, doing nothing in the home. They just encouraged, always kept a chair reserved for him at the dining hall when they were having the breakfast. Always encouraged him to put the alarm, and whenever they go for any family event or social gathering or any some community gathering or any religious activity, they invited him. They tried their level best to include him. That is the way we bestow support. That is the way we maintain that relationship and make the client understand we are helping you, we stand for you. Secondly, economic status and employment. Think about a situation in which a client has undergone diagnosed with bipolar and he or she was manic at first. Later on, after coming here, as you know, it's a mood disorder, so the mood may fluctuate and they may dip into a depression. So when going out from here, this is a real case. The case was recently happened, and the client didn't want to do anything as he was in depression. The family helped him to enroll into some sort of college of his own interest, but he was not ready to take part in the college, and the family understood that. Even though they wanted him to engage into some sort of activity, they didn't leave him alone as he was expressing depression, but they gave him an alternative option. Okay, you don't have to go to a college, but you can go for a part-time job, like 4 hours of job. It is not a big deal, and he agreed for that. He said, I'm not equipped myself to get into a course now. Let me just work it out for 4 hours a day. And they have given that option. Even though he is into his surging age of 24, he's working part-time, he hasn't completed his studies, but he is enabled with the family support, and they have provided that employment opportunity for him to understand or help him to develop that self-esteem and be confident about his condition. So that is our next point, education and awareness. If the family was not educated enough to understand regarding these concerns, the psychological well-being is gone, mitigated. We don't have any option. Like, I mean, if the client is not ready to do anything, like they are not motivated enough to do anything, if we force him to do something, like you have to go for a course, you have to go for a walk, you have to find earning for yourself, it doesn't work like that. They may feel suffocated. Understand the needs, understand the situation. As family members, what we can help them to do is, at first, make it clear, we understand your situation. You have a certain condition and we understand it completely, but with due respect, we want you to engage into some sort of activity. You can get the assistance of us. We can advise the clients, like the treating team can play a crucial role over there, helping the family and the client, just advising him, okay, find something right for the choice. Like at the time, you're not able to spend or give attention to a 12-hour job or like a 8 hours course. Okay, go for something simple, minimal. Start small and simple. Nothing is going to happen dramatically. Small steps, patience, resilience, that would only make it change. As we have discussed in the last one, like the acceptance of that factor is the major thing. Then community and social network, like help them to involve or indulge into some sort of activity which provides a networking. Like rather than just providing help by the family members, we can think of certain community activities. Like there are walking clubs in Cadabam. There are certain cycling clubs, like a book club or sort of literary activities which of their interest at least help them to network with those people as well. Then we have stigma and discrimination, very important. All of us are stigmatized, all of us. Even though we say we don't have any sort of judgment, at times as observations we make judgments, and it can directly or indirectly mitigate the condition of the client, and it can feel them ashamed. Like there are two types of stigmatized. As all of us are stigmatized, the client is also stigmatized. That is internal stigma. Secondly, there are external stigma. Like I had a client who was admitted here for 4 months, and this 4 months of period, the family was hiding the fact from the neighbors that the client was admitted to a rehabilitation center. It's a common thing. I mean, it happens with most of the families. And somehow the neighborhood came to know about this. And when he came back after the discharge, he was questioned, basically confronted by the neighbors that, so you were in a psychiatric rehab. So it got triggered, and fortunately the client didn't went into relapse, but we could intervene productively and fruitfully. We addressed that situation. Who was helped here is the father. The father advocated for the client that, okay, he had certain condition, but it doesn't mean he cannot come out. It doesn't mean you can question or trigger his psychological well-being with your fingers pointing him. So basically, advocating has to be done at the time of stigma and discrimination. If the client is being discriminated from the society, it doesn't happen. As she has already explained, it is just like diabetes. There are also some hormonal imbalances, and here we have few. And the last one, access to care and resources. As few major things as a social worker, I can help you to understand there are certain things called accessibility, and affordability. But I believe all of us are affordable enough to, or accessible enough to get into the right treatment. The thing is, intervention doesn't happen at the right time. Early intervention makes major differences. Like we had that example of what are the differences between mental retardation and like what are the normal illness or chronic illness which we see as schizophrenia bipolar. See, autism, I can take that example, not a great example, even though autism is diagnosed before the age of 2, mandatory. It is like that. It is not diagnosed at adulthood. The thing is, often the families would find this kid having autism at the age of 4 or 5, and they may treat him at the age of 6 or 7. Where is the early intervention? This could have been this client could have been Albert Einstein. Albert Einstein had Asperger's syndrome, but it has been intervened at the right time. And we have many cases who are going to chronic stages just because they lack that early intervention. I deeply respect and appreciate all of our families who have come here because you made the right choice to treat the client. Around 60% of the people who are suffering from most of the mental illness doesn't do that due to the stigma, due to the judgments they behold, due to the trauma or sort of fear they've been possessing for a long time. So that's the difference. You can go to the next slide. So why social factors matters in recovery? As medication treats symptoms, therapy builds coping skills, but social environments decides if the person can live well. I can give the medicine at the right time. We can go for regular therapy, but if the client is being not treated well by the caregivers of the family or people who are in his environment, there is no point in seeking all of this. Again, positive social support reduces relapse, improves functioning, and gives hope. As I said, it can help them to build their self-esteem, confidence, and they feel that they're being cared by the environment, and they can come out of stigma. All these factors matters. Go to the next. So it's your turn. We have an activity here. Like I kept a box here, biopsychosocial approach. As 3 of us have explained it to you, you will be asked to write. I mean, we are just concluding and wrapping up the session. We'll just ask which are the factors which you might have seen in your family members, like the client who has been admitted here. Which one do you think mostly? Or you can just write what are the factors. We had biological factors mostly covered with the genetics and stuff. And we had psychological factors in which we have discussed about behavior, cognition, and feeling and emotions. And at last, I have explained about the social factors. So, what might have affected your client majorly? So, you don't even have to write the name of the client. You can just write what are the factors, and you can just come and put it here. And we will provide you a handout. With that, you can refer that. Which are the factors which we have discussed. Yeah. So we will just conclude this session and thank you for writing, and we will just go through. It was a part of research, like which are the factors which would mostly impact our resilience. We will just go through it, and maybe on the next session we can have a result of that. Yeah, thank you once again for coming, and we are expecting you for the next session as well. So on behalf of my team, I extend my gratitude and thank you for the moderators and coordinator, Mr. Jitsa, and also Dr. Diksha for helping us to deliver our insight or information or knowledge which we have possessed for so long. And thank you once again for coming. We appreciate it. Thank you.